If you're over 60 and care about keeping a healthy, functioning body, especially when it comes to your most private parts, stop what you're doing and pay close attention. What I'm about to share may spare you from pain, embarrassment, and yes, even surgery. I've seen it happen far too often. My name is Dr. Edward Mason, a board-certified urologist with over 3 decades of experience in men's health. Over the years, I've helped thousands of older men, veterans, fathers, retirees, take back control of their health and protect what matters most: their confidence, their freedom, and their dignity. There's a common myth that problems down there are just an unavoidable part of aging. But the truth is, many of these issues stem from small, avoidable mistakes. I see these errors all the time in my practice. Today, I want to walk you through 10 things men over 60 should never do to their penis and what you should be doing instead. These 10 rules can help you avoid painful conditions, infections, and even certain cancers. They could make all the difference in your quality of life. Be sure to stick around until number 10, because that final mistake is responsible for more long-term damage than most men realize. Let's dive in. Before we begin, if you haven't yet subscribed, take a second to hit that button and turn on notifications. I provide practical, no-nonsense health tips specifically tailored for men over 60. And if this message speaks to you, drop a 1 in the comments. If not, type 0. Your feedback helps me bring you more useful, honest content. Now, let's get into the first rule, one that's often overlooked, but incredibly revealing. Pay attention to your erections. You might not think of it this way, but your ability to get and keep an erection isn't just about intimacy. It's about your overall health. In fact, it's one of the earliest signs your body gives when something's off internally, especially in your heart and circulatory system. Here's the first thing. Never ignore changes in your erections. Let me say something I wish every man heard decades earlier. Your erections are a vital health signal, just like your pulse or blood pressure. What's happening with your sexual function is your body trying to get your attention. Once you reach 60, that message becomes even more critical. I've met so many patients who brushed it off as a normal part of aging. They'd laugh and say, "Doc, I just don't have the same fire anymore." But when we dig deeper, we often discover high blood pressure, blocked arteries, or even undiagnosed diabetes. Studies show erectile dysfunction can precede a heart attack by several years. That means your body could be warning you before your heart ever does. I'll never forget one gentleman in his 70s who came in for a routine visit. He casually mentioned he'd been having trouble maintaining erections, said it was probably stress. We ran a few tests just to be sure. Weeks later, he was diagnosed with coronary artery disease. The bottom line? Your body is talking. The question is, are you listening? Edward was lucky. He got the treatment he needed. And today, he's still cherishing every moment with his grandchildren. He once told me, "I thought I was seeing the doctor for a bedroom issue, but really, my body was trying to save my life." I want to make something very clear. Occasional trouble with performance happens to everyone. We all have off days, but if you're seeing a steady drop in morning erections, libido, or overall function, don't shrug it off. This isn't about pride. It's about your circulation, hormonal health, nerve signaling, and emotional well-being. These systems are deeply interconnected when it comes to erectile function. If one of them falters, your penis might be the first to sound the alarm. The upside? Taking this seriously can improve more than just your sex life. It might help you live longer. So don't wait until it gets worse. Talk to your doctor, ask questions, get the checkups you need. It's never too late to regain control of your health. Because while a neglected symptom may seem small, what it's trying to tell you could be life-changing. Now let me ask you something. What if one of the most harmful things you could do to your sexual health is actually something many men try in hopes of fixing it? Let's talk about that now. And if you're still with me and this message is speaking to you, drop a number 1 in the comments. That lets me know you're here and engaged. Your feedback matters. Now, let's move forward to our second point. 2. Avoid home remedies and unverified devices. This is a hard conversation, but it's necessary. because I know where it comes from: desperation. I've seen decent, thoughtful men veterans, fathers, hardworking husbands turn to the internet late at night searching for solutions. When things stop working the way they once did, and when intimacy feels out of reach, it's tempting to try anything that promises results. Pills, oils, creams, odd techniques, homemade devices promising miracles with no real effort. But let me tell you, from over 30 years of experience in men's health, these shortcuts can do real harm. I once saw a man in his late 60s who used a vacuum device he found online. He was too embarrassed to seek help right away. By the time he came to see me, the pain, swelling, and bruising were severe and the tissue damage was irreversible. All he wanted was to help himself, but without professional guidance, he ended up suffering instead. There's also this technique called gelching that's gone viral on online forums and YouTube. The idea is that repeated stretching will somehow increase size, but what I've seen in real life are torn tissues, scarring, and in many cases, long-term erectile dysfunction. The worst part? Most men never talk about it. They don't seek help until the damage is done, when it's often too late. So please don't risk your health on quick fixes that aren't backed by science. The real solution comes from understanding your body, addressing the root cause, and working with someone who knows how to help. Healing is possible, but only when you walk the right path to get there. The truth is, when it comes to sexual health, if something sounds too good to be true, it probably is. There's no miracle herb that reverses aging, no secret formula that adds inches overnight, and certainly no plastic gadget from a random website that can replace the care and expertise of a licensed medical professional who genuinely has your best interest in mind. I know how difficult this can be: the silence, the worry, the desire to feel like yourself again. But please don't let that vulnerability push you toward harmful choices. Talk to someone, get evaluated properly, solve the right problem the right way. Because the worst thing you can do for your sexual health isn't just ignoring warning signs thinking you can handle everything in silence without real guidance or support. Now, on the topic of things we don't talk about enough, when was the last time you really checked in with your body? Not just a glance, but a real check. Sometimes what you don't see or don't want to look at could be putting your health at risk. So, let's talk about that next. 3. Never skip hygiene, but don't overdo it. I get hygiene isn't exactly an exciting subject, but it's one of the most overlooked causes of problems I see in my clinic. I've treated countless cases of discomfort, inflammation, and even infection that could have been prevented with a more balanced approach to personal care. The issue isn't just poor hygiene, it's also too much hygiene. I remember treating a man named Harold, a retired trucker in his early 70s. Gritty, no-nonsense kind of guy. He walked in with an angry red rash and said, "Doc, I wash it twice a day. I don't know what's going on." That was the problem. He was over-scrubbing with heavily perfumed soap and even using a loofah. His efforts were well-meaning, but they were backfiring, stripping his skin's natural protection, leaving it raw and vulnerable to irritation. Here's the thing, the skin in that area is delicate, especially if you're uncircumcised. It doesn't need aggressive cleaning. Just warm water, a touch of mild, fragrance-free soap, and a gentle towel to dry off. That's it. And yes, if you have a foreskin, it's important to retract it and clean underneath gently. Otherwise, moisture and bacteria can build up and cause balanitis, and infection that can be painful, itchy, and in some cases, lead to more serious complications like scarring or trouble retracting the foreskin altogether. But on the other end, there are men who avoid touching or inspecting themselves at all. Sometimes it's shame. Sometimes it's cultural. Either way, it leads to silence, and silence is dangerous. I've seen patients go years without noticing a sore, a lump, or discharge, simply because they weren't familiar with what normal looks like for them. I'm not saying you need to become obsessive, but I am saying you need to be in tune with your own body. Know your baseline. That way, if something changes, whether it's color, texture, swelling, or sensation, you'll be able to spot it early and get help before it becomes something worse. Your hygiene routine doesn't have to be elaborate. just needs to be consistent and gentle. Treat your body with the same care you'd give something truly valuable, because it is. Now imagine this. You've done everything right. You've kept yourself clean, paid attention to changes, even kept up with doctor visits. And then one day, out of nowhere, you feel a sudden pain or notice bleeding that shouldn't be there. What should you do next? That's exactly what we're going to talk about right now. If you're still with me and these insights are resonating, go ahead and drop a number 1 in the comments. It's a small gesture, but it helps me know you're here and engaged. Let's move on. 4. Never ignore pain, bumps, or bleeding. For many men, especially those raised in a time when strength meant silence, the instinct is to tough it out, push through. Don't complain unless the pain is unbearable. I get it. That mindset is deeply ingrained. But when it comes to your sexual health, that silence can be dangerous. In some cases, it can even be deadly. I'll always remember one man I treated, a quiet gentleman in his late 60s. He came in only because his wife insisted. He had noticed a small sore on the tip of his penis months earlier, maybe longer. It didn't hurt much at first, so he ignored it. Over time, it grew, but embarrassment and fear kept him from seeking help. By the time he did, the diagnosis was advanced penile cancer. We did what we could, but surgery was unavoidable, and the outcome changed his life permanently. If he had come in when the sore first appeared, treatment could have been simpler and far less life-altering. Pain, unusual sores, bleeding, these are not random occurrences. They are messages from your body that something needs attention. Now, that doesn't mean it's always something severe. It could be an infection, a sexually transmitted disease, even something like a kidney stone. But if you're seeing blood in your urine, feeling burning, noticing lumps, or experiencing persistent irritation, do not wait. Don't fall into the trap of thinking it'll clear up on its own. That voice telling you it's probably nothing, that's not reason, it's fear pretending to protect you. And let me say this clearly. No compassionate, experienced doctor is going to judge you. We're here to help, not to shame. We've seen it all, and what matters most is that you show up. Whether it came from intimacy, a past injury, or something you can't quite explain, the earlier we know, the more we can do. Your sexual health isn't just about function. It's deeply tied to your identity, your self-worth, and your ability to feel in control of your life. It deserves your attention, because often, the difference between a minor fix and a major procedure comes down to one thing: how soon you decide to act. Now that we've talked about recognizing the signs your body gives you, let's turn to something even more subtle. What if I told you that sometimes, even when things feel good, you might still be causing harm without knowing it? That's where we're headed next. 5. Avoid rough or uncontrolled sex. Let me be direct. Over the years, I've seen many injuries, but few are as alarming or as painful as a penile fracture. And yes, it's exactly what it sounds like. It happens more often than people expect, particularly in older men who feel the need to prove they've still got it. I once treated a 64-year-old widower who had recently started seeing someone new. One night, he rushed into the ER, visibly shaken and in severe pain. During sex, he heard a loud popping sound, followed immediately by swelling and intense discomfort. At first, he hoped it would go away, but within minutes, his penis became badly bruised and bent, what we refer to as the eggplant deformity. That sound he heard? It was the rupture of the tunica albuginea, the membrane that surrounds erectile tissue. This isn't just a painful scare, it's a true medical emergency that requires surgery. Here's the important takeaway. Sex after 60 can be deeply satisfying physically, emotionally, and spiritually. But trying to replicate the intensity or pace of your younger days without recognizing your current physical limits is risky. Forceful thrusting, high-impact positions, and lack of communication with your partner can all lead to serious injury. When you're fully erect, your penis is actually more prone to damage than you might think. You don't have to be afraid, but you do need to be careful. The answer isn't to avoid intimacy. It's to be present and attentive. Use adequate lubrication. Move at a steady, intentional pace. Talk to your partner about what feels good and what doesn't. If you feel like you're starting to lose control or things are becoming too intense, pause. Intimacy isn't a competition. It's a connection. And the best experiences happen when you feel secure, calm, and fully engaged, not when you're pushing past your body's limits. Now that we've addressed how to protect your penis, let's not forget the rest of the reproductive system. Believe it or not, something as soothing as a hot soak or a relaxing sauna might be doing more damage than you realize. Let's get into that. 6. Never let your testicles overheat. It might sound a little surprising at first, but keeping your testicles cool is one of the easiest and most effective ways to support your sexual health as you get older. There's a reason that part of the body hangs outside your core. It's temperature, sensitive, and needs to stay a few degrees cooler than the rest of you in order to function optimally. But many men never think twice about this. I once worked with a 68-year-old retired teacher who came in complaining of low energy, brain fog, and declining interest in sex. He chalked it all up to age, but after running some tests, we discovered his testosterone levels were significantly lower than normal. As we looked deeper into his daily habits, one detail stood out: was spending hours soaking in a hot tub every day and often placed his laptop directly on his lap. He had no idea that all this heat exposure could be quietly disrupting his hormone balance even at his age. Now, you might be thinking, fertility, really? At this stage of life? But it's not just about reproduction. Testosterone plays a key role in your energy levels, mood, muscle maintenance, bone strength, and yes, your sexual function. When your testicles are frequently exposed to heat, sperm production slows down, and so can your natural testosterone output. And the modern lifestyle isn't making it easier. Heated seats, snug-fitting underwear, extended periods of sitting, and personal devices placed close to the grointies all contribute to long-term heat exposure. The solution doesn't require an ice bath or drastic changes. It's about awareness. Use a lap desk instead of resting your laptop directly on your thighs. Avoid spending too long in hot tubs or saunas. Choose underwear that's breathable and loose-fitting. These small changes may seem trivial, but over time, they can make a real difference in how you feel and function. Heat might feel comforting on sore muscles, but when it comes to your hormonal and sexual health, too much of it is quietly working against you. And while that's one kind of pressure, there's another that often goes unnoticed, one that comes from how we treat ourselves during private moments. Let's talk about a habit many men don't realize is causing harm. 7. Avoid using a tight or aggressive grip during masturbation. It's a subject few people like to bring up, and when they do, it's often with humor or discomfort. But this is something we need to address seriously, because how you treat your body when you're alone can influence how it responds with a partner. And yes, that includes your approach to masturbation. One of my patients, a man in his early 70s who had been single for years, finally admitted something during a checkup. "Doc," he said, "I can get hard sometimes, but sex just doesn't feel like anything anymore." So we talked, and what we uncovered is something I've seen far too often. For years, he had used a very tight, fast, high-pressure grip whenever he masturbated. Over time, that specific stimulation became the only kind his nerves and brain responded to. This is known as death grip syndrome, and it's more widespread than most people think. The problem isn't how often you do it, it's how. When you consistently use too much pressure, rush the process, and isolate the experience from any emotional or physical connection, your body starts to associate pleasure with that very narrow set of conditions. Then, when you're with a partner, things don't feel the same. The natural sensation, warmth, and rhythm of intimacy don't register the way they should. It's not about shame, it's about understanding your body and treating it with care. Adjusting your habits can retrain your sensitivity and improve your ability to connect, not just physically, but emotionally. Because real intimacy isn't built on pressure, it's built on presence. Masturbation shouldn't be something rushed, aggressive, or shrouded in guilt. It can absolutely be part of a healthy self-care routine, especially as you get older, but it needs to be gentle, intentional, and aligned with the kind of touch and connection you'd experience with a partner. Use lubrication, slow down, breathe. Let yourself feel the experience instead of just trying to get through it quickly or use it as an escape. And most of all, let go of the shame. Many of us were raised in an environment where men were taught to hide their desires and keep quiet about their needs. But that silence creates confusion. And when you're confused about your body, you develop habits that over time can quietly undermine your health. The good news? Your body can learn new patterns. You can rebuild that sensitivity, but it starts with treating yourself kindly, even when no one's watching. Now, while we're talking about subtle but serious threats to sexual health, there's one habit that causes more harm than almost anything else. It's legal, it's normalized, and it's incredibly addictive. Let's get into it. 8. Quit smoking and start moving. If I could offer just one piece of advice to every man over 60 who walks through my office, it would be this: stop smoking. Not later. Not when you feel ready. Do it now. I've watched cigarettes destroy more relationships, more health, and yes, more erections than nearly any other habit out there. One patient in particular stands out. He was a retired Navy mechanic in his late 60s. He told me proudly, "Doc, I gave up drinking. I stopped eating red meat. But cigarettes? That's the one thing I've held on to." Unfortunately, that old friend was robbing him of his sexual vitality. He came in complaining of weak, inconsistent erections. After some testing, we found the usual culprits: high cholesterol, poor circulation, and stiff, narrowed arteries, including those responsible for blood flow to the penis. And at the center of it all, decades of smoking. Here's the truth. Your penis is a vascular organ. It relies entirely on healthy blood flow. It functions like a pressure system. And when your blood vessels are damaged from smoking, your ability to get and maintain an erection is the first to suffer. But by the time those problems appear in the bedroom, chances are the damage has already started in your heart, brain, and lungs too. But this isn't just about quitting something harmful, it's also about adding something healing: movement. Even a simple 30-minute walk each day can work wonders. It improves your circulation, supports testosterone production, boosts energy, and restores confidence. You don't need to lift heavy weights or spend hours in a gym. Just move your body. I've watched men in their 70s, men who never touched a dumbbell in their lifer, claim their strength, their vitality, and their sex life with nothing more than walking and light body weight training. When you care for your body, when you sweat a little, breathe deeply, and show up for yourself, it responds. It gets stronger, it heals, and yes, it performs better in every way that matters. You might feel like it's too late, that the damage is already done, but the truth is, it's not. Your body still has the capacity to recover if you give it the right conditions. The first step is always the hardest, but once you take it, everything begins to change. Now, you've probably heard the phrase, mind over matter, right? Well, when it comes to your erections, your mindset can either become your strongest supporter or your biggest obstacle. 9. Don't carry shame around performance issues. If there's one burden I wish I could lift off every man's shoulders, it's the silent weight of shame. I've seen it countless times in the posture, the hesitations, the eyes of men who walk into my office. Men in their 60s, 70s, even 80s reluctant to say it out loud, not because of physical pain, but because they feel like something essential has slipped away. Their confidence, their identity, their sense of being the man they once were. One man in particular, a retired firefighter at 72, said something I'll never forget. "Doc, I used to run into burning buildings without hesitation. Now, I can't even face my wife." His voice cracked. And I told him what I'll tell you. You are not broken. You're not less of a man because your body has changed. You're human. And these changes are part of the journey, not a measure of your worth. The reality is, every man experiences changes in sexual function with age. Some of it's physical blood flow, hormone shifts, nerve sensitivity. But more often than we admit, it's rooted in mindset. One disappointing moment leads to fear. That fear creates anxiety. The anxiety causes another struggle. Before long, the problem isn't physical, it's the mental loop we can't escape. Breaking that cycle starts with giving yourself grace. It means letting go of the idea that performance defines your value. It means remembering that intimacy is about connection, not just completion. When you stop grading yourself based on a single act, you create space to feel again, to enjoy again, to be truly present. Open up to your partner, be honest. Most people don't want perfection. They want honesty and closeness. And if you're carrying this silently, consider talking to a counselor or therapist who understands men's health. There's no weakness in seeking help. In fact, it's one of the strongest things you can do. Now, let me leave you with this. What happens to a muscle you never use? It weakens. It shrinks. Eventually, it forgets how to work. The same idea applies to your penis. So what does that mean for the road ahead? Let's wrap this up with a message every man over 60 needs to hear, because your future health might just depend on it. 10. Don't stop having erections altogether. You've probably heard the old saying, use it or lose it. And when it comes to your sexual function, that's not just a catchy phrase, it's rooted in real science. Over the years, I've had countless men over 60 sit across from me and say something like, "Doc, I just don't really get erections anymore. I'm not that interested these days." What they often don't realize is that spontaneous erections, especially the ones that happen during sleep, are not just about sexual desire. They're your body's way of keeping things functional. When you go too long without erections, the tissues inside the penis begin to change. They can lose their flexibility. Blood flow diminishes, and over time, scar tissue can start to develop. Yes, this can lead to actual, measurable shrinkage. That's not a myth. It's a physiological response to inactivity. Even more, the brain starts scaling back your sexual response. Just like with any system in the body, if you stop using it, it starts to shut down. I once worked with a man in his late 60s who hadn't had any sexual activity solo or partnered for nearly 2 years. He figured it didn't matter anymore. But when he entered a new relationship and wanted to reconnect physically, his body no longer responded. The impact wasn't just physical. It affected his confidence, his connection, and his sense of identity. The truth is, regular erections, whether with a partner or through mindful solo activity, help keep the tissue oxygenated, flexible, and responsive. Think of it like regular maintenance for your health. And it's about more than the physical. Staying in touch with this part of yourself can nourish your sense of energy, connection, and intimacy, especially in long-term relationships. This isn't about pressure or performance. It's about allowing yourself to stay engaged with something that remains meaningful at any age. So if you've drifted away from that part of your life, ask yourself honestly, is it because your desire truly faded, or because you've been convinced that it no longer belongs to you? Now that we've covered all 10 of the things every man over 60 should avoid for better sexual health, let's close this out with what truly matters most. Final thoughts. If you're still here, I want to take a moment to speak not just as a physician, but as someone who's had the privilege of walking alongside thousands of men in your shoes. Men who have spent decades working hard, providing for others, enduring setbacks, and quietly carrying private worries about the changes they're experiencing. I want you to hear this clearly. You are not alone, and it is never too late to reclaim your health, rebuild your confidence, or improve your quality of life. We've covered a lot today. We talked about how erections are more than just a part of sex, they're a vital signal of your overall health. We explored the risks of using unproven home remedies and how thoughtful, consistent hygiene can help you avoid major problems. We discussed how important it is to listen to your body when something feels off, and why safe, respectful intimacy is about more than just physical performance. We looked at how excess heat can quietly lower your hormone levels, and how certain solo habits like using an overly tight grip can influence your connection with a partner. We talked about how smoking damages more than your lungs or heart. It can rob you of your sexual vitality. And we didn't shy away from one of the hardest truths of all, the deep, quiet shame many men carry when things don't work the way they used to. We ended with a reminder that staying sexually active isn't about proving anything. It's about staying engaged with your health, your emotions, and your relationships. Because sexual health isn't about being young, it's about being connected. Connected to yourself, your energy, your sense of presence. Maybe some of this conversation caught you off guard. Maybe it made you reflect or even squirm a little. That's okay. Growth often begins where discomfort lives. But here's what I want you to take with you. Even the smallest step forward, a phone call, a new habit, an honest conversation can lead to better health, more confidence, and a deeper, more meaningful life. You deserve that. You deserve to feel good in your body, to be informed, to feel proud of the man you are at any age. And if you've been waiting for someone to tell you it's okay to begin, this is that moment. Start now. If anything I shared today resonated with you, even one part made you pause and think, go ahead and give this video a thumbs up. That simple action tells me this kind of open, honest conversation matters to you. And if you know a brother, a friend, or a partner who could benefit from this message, don't keep it to yourself. Share it. You never know who might be silently wondering the same things, and one small gesture could be the nudge they need. I'd also love to hear from you. Whether you have a question, a story to share, or just want to say you're here, I welcome your voice in the comments. This space is built for real talk, and your feedback helps me know what to bring to you next. And if you haven't already, don't forget to subscribe and turn on notifications. I'll be sharing more content designed specifically for men like you, men who want to stay informed, stay strong, and live fully at every stage of life.